Welcome to the Deep Dive, where we plunge into the incredible intricacies of modern life, giving you a shortcut to being well-informed and, dare I say, thoroughly fascinated. Today, we're talking about an astonishing level of precision, a dexterity that truly borders on magic, really, and the delicate operations that happen inside the human body with barely a whisper on the outside. Imagine, for a moment, the almost unbelievable skill required for surgeons to repair, reconstruct, and meticulously reconnect vital tissues and organs. Now, what if we told you that much of this incredibly delicate sewing and stapling is performed not with a direct open view, but while the surgeon is looking at a high-definition screen operating through tiny keyhole-sized incisions? It's a marvel that transforms recovery for millions. That's right. Today we're taking a deep dive into the fascinating world of laparoscopic surgery, specifically the ingenious tools that make such intricate, minimally invasive reconstruction possible. We're focusing squarely on the very heart of the modern surgical sewing kit: suturing and stapling instruments. And these aren't just scaled-down versions of traditional tools, not at all. They are truly marvels of engineering, designed to overcome challenges that were once considered, well, pretty much insurmountable.
Exactly. And our mission today is to provide you with a clear, concise pathway to understand not just what these specialized instruments are, but how they conquer some truly incredible technical challenges. We'll explore in detail how they enable surgeons to close incisions, meticulously repair tissues, and create incredibly secure connections deep inside the body with remarkable safety and efficiency. Prepare for some genuine aha moments as we uncover the genius behind these surgical innovations and consider how they've really redefined what's possible in the operating theater.
Yeah, I think that's key. By the end of this deep dive, you're going to walk away with a newfound, profound appreciation for the sheer dexterity required and the advanced technology involved in modern surgery. You'll understand not just what these tools do, but more importantly, why these very specific, highly specialized instruments are so crucial to the success of today's minimally invasive procedures. It's a story of human ingenuity meeting physiological needs, and it's truly a game changer for patients worldwide. Okay, let's unpack this then. When most of us think about sewing, we picture our own hands, right? Maybe a simple needle and thread, or perhaps even the rhythmic whir of a sewing machine. We visualize direct contact, the tactile feedback of the fabric, the ability to maneuver the needle with complete freedom, and the subtle artistry of tying a secure knot. But now imagine trying to replicate that precise manipulation, that delicate knot, tying not with your hands directly on the material, but inside a patient's body, through tiny incisions barely a centimeter long. And you're using instruments that are many times longer than your arm. What makes this particular challenge so incredibly difficult and complex for a surgeon, moving from the open field to this keyhole approach?
Well, what's truly fascinating here is that the very nature of laparoscopy being minimally invasive, which offers immense benefits to the patient in terms of recovery, simultaneously introduces significant technical hurdles for something as fundamental as suturing. It's a real paradox. The challenges are multifaceted and demand highly specialized, often counterintuitive solutions. Historically, every internal repair required a large incision, giving the surgeon direct vision and, crucially, direct touch. Laparoscopy changes all that. Firstly, you have the sheer length of the instruments. Imagine trying to perform intricate calligraphy with a pen that's, say, 3 feet long. Operating through small ports with these extended instruments means that the surgeon's hands are often a considerable distance from the actual working tip inside the body.
Right, so your hands are way out here, but the action is happening way down there.
Precisely. And this radically changes the fulcrum point. It shifts from the surgeon's wrist, like in open surgery, to the tiny port incision in the patient's abdominal wall. This shift means that a small, precise hand movement outside translates into a significantly larger and often less precise arc of motion at the instrument's tip inside the body. It requires a complete relearning of fine motor control, almost a reversal of natural dexterity.
Wow, okay, so it's not intuitive at all.
Not initially, no.
Yeah.
Secondly, surgeons are operating within a confined three-dimensional space that's projected onto a two-dimensional screen. Now, modern laparoscopes offer incredible high-definition views, no doubt, but the depth perception is inherently limited. It's just not the same as looking directly.
You lose that third dimension.
Yeah, exactly. And this confined space also offers severely restricted movement and often forces surgeons into incredibly awkward angles for needle manipulation. Think about trying to pick up a tiny object with tweezers through a very narrow slot, then rotating it and pushing it through another tiny slot, all while only seeing a flat image on a monitor.
Yeah, that sounds incredibly frustrating.
It can be. The visual field is limited, and the natural range of motion of a human wrist and hand is severely constrained by the port sites, making tasks like tissue retraction or precise needle articulation extraordinarily difficult. Actually, this was a hot topic at a recent medical conference. I attended the sheer ergonomic challenge alone for surgeons, just physically doing this for hours.
I can only imagine the strain.
And then there's the third and perhaps most critical difficulty: reduced tactile feedback. Haptic feedback.
The sense of touch.
Exactly. In traditional open surgery, a surgeon can feel the tension in the tissue, the resistance of the needle as it penetrates, the subtle changes in texture and thickness, all those little cues. The sense of touch, or proprioception, is absolutely crucial for judging how tightly to pull a suture, how deeply to penetrate tissue, or if a knot is secure.
You just know when it feels right.
Right. In laparoscopy, that vital tactile feedback is significantly diminished or even entirely absent. It's like trying to thread a needle while wearing thick, numb gloves, but you can only see it on a screen. Surgeons must develop a completely new sense of intuitive understanding, relying heavily on visual cues and their accumulated experience.
So, given all that, it really begs the question.
Why do it? Yeah. Why would surgeons voluntarily opt for such a technically demanding approach, given these formidable challenges? The answer lies fundamentally in the bigger picture of patient recovery and reduced trauma. That's the driving force. Minimally invasive surgery significantly reduces postoperative pain, decreases blood loss, shortens hospital stays, and allows for faster overall recovery compared to open surgery. The benefits are huge.
So it's a trade-off. Harder for the surgeon, much better for the patient.
In essence, yes. So while suturing in this environment is incredibly challenging, the patient benefits are immense: less scarring, quicker return to normal life, and fewer complications associated with large incisions. It was precisely to overcome these formidable obstacles that specialized suturing and stapling instruments were developed. They weren't just minor tweaks, they were fundamental redesigns. They were designed, engineered, and refined to make complex tissue reconstruction safer and more efficient, effectively transforming what was once an almost impossible manual task into a manageable and routine part of modern surgical practice, pushing the boundaries of what a surgeon can achieve.
The analogy you used earlier about trying to thread a needle through a keyhole with chopsticks. It's perfect for illustrating the magnitude of the challenge. It wasn't just about scaling down existing tools. The problem was so profound that it demanded a complete rethinking of how to achieve such delicate tasks remotely. It required entirely new principles of instrument design and surgical technique, just a whole new approach. So, given these truly remarkable challenges, the limited space, the indirect vision, the profound lack of direct tactile feedback, what are these ingenious sewing tools that surgeons rely on to perform their intricate work? How did engineers and surgeons collaborate to fundamentally reinvent something as ancient as a needle and thread for this new frontier? Let's dive into the specifics of the instruments designed specifically for laparoscopic suturing.
Okay, let's start with the fundamentals. The workhorses of laparoscopic suturing are the needle holders. These are, in essence, the surgeon's extended, hyper-precise fingers inside the body, meticulously crafted to overcome the physical limitations of minimally invasive access.
So they're not just holding the needle, they're compensating for those limitations.
Exactly. Their design is quite specific, focusing on control and precision. They are long-shafted, slender instruments, often rotatable 360 degrees. This rotation allows the surgeon to adjust the angle of the needle with fine precision, even when their hands are outside the patient's body and their wrist movement is constrained by the small port.
Okay, that makes sense. The rotation gives back some lost maneuverability.
Correct. Crucially, they feature ergonomically designed handles that are far more than just comfortable grips. They are engineered for maximum control, allowing for a precise, almost one-to-one translation of subtle hand movements into exact needle manipulation, despite the physical distance and altered fulcrum point.
You mentioned something about the jaws earlier. Tungsten carbide. That sounds incredibly serious and robust. What's the significance of that material, especially for something as seemingly simple as the jaws of a needle holder? It seems like an extreme choice for gripping a thin, curved needle.
Good question. It's not just a choice. It's a deliberate and absolutely critical engineering decision. The jaws of these needle holders are equipped with firm, often serrated, tungsten carbide inserts.
Okay.
Tungsten carbide is an exceptionally hard and durable material, renowned for its wear resistance and superior gripping properties, even compared to stainless steel. Now imagine operating in an internal environment where tissues can be slippery with blood and fluid, and precise, consistent needle placement is paramount,
Right. Things could slip easily.
very easily. A standard metal jaw might allow the needle to slip, rotate unexpectedly, or even damage the needle itself. Tungsten carbide ensures a supremely secure, non-slip grip on the needle, preventing any unwanted movement during the critical phases of tissue penetration, manipulation, and knot tying.
So the grip is everything.
It's fundamental. This secure grip is the cornerstone of laparoscopic suturing. It enables surgeons to confidently perform both intracorporeal knot tying.
That's tying the knot inside the body.
Yes, where the entire knot is meticulously tied inside the body, demanding incredible dexterity and a new kind of spatial awareness, and also extracorporeal knot tying.
Which is tying it outside and pushing it in.
Correct, where the knot is formed outside the body and then carefully pushed into position. Different needle holder designs also exist, some with straight jaws for direct passes, others with angled or curved jaws for reaching around structures. Without this firm, reliable grip, the entire process of laparoscopic suturing would be far riskier, less efficient, and, frankly, less safe for the patient. A dropped or slipped needle could cause serious complications or prolong surgery significantly.
So this isn't just a fancy pair of pliers, it's a finely tuned, high-tech extension of the surgeon's hand, meticulously engineered. It's specifically designed to compensate for the severe lack of direct touch, providing that essential certainty and control in an otherwise incredibly challenging environment. It's about engineering solutions to overcome physiological limitations, giving the surgeon confidence in every stitch.
It's exactly right. Building on that foundation, we have endo-stitch devices. These are truly innovative because they represent a significant step towards simplifying and standardizing the laparoscopic suturing process, particularly in high-volume or complex cases. Think of them as sophisticated, reloadable suturing systems that streamline what can be a very intricate and physically demanding manual skill. They were a major discussion point at surgical workshops not long after their introduction, praised for their ability to make certain complex closures more accessible.
Here's where it gets really interesting for me. Simplify the process sounds like music to a surgeon's ears when facing such dexterity challenges and the pressure of operating inside a living patient. But how exactly do they simplify it? What's the clever mechanism at play here, taking a burden off the surgeon's hands?
Well, the mechanism is quite ingenious and almost akin to a miniature internal sewing machine, in a way. Instead of the surgeon having to manually grasp, rotate, and pass the needle through tissue repeatedly, the endo-stitch device holds a small, curved needle on a fixed internal track.
Okay, a fixed track.
Yes. And with each click of the handle, an internal shuttle mechanism advances and retracts the needle, piercing the tissue on one side and then capturing it on the other, consistently and precisely. This almost automates the most challenging and repetitive parts of suturing, especially the needle entry and exit points. It takes a huge amount of the fine motor control burden off the surgeon's individual dexterity for each individual stitch.
Wow, that sounds significantly easier.
It certainly reduces the complexity. This design significantly reduces the steep learning curve traditionally associated with mastering advanced laparoscopic suturing. Surgeons can achieve competence more quickly and consistently, making complex reconstructive techniques more accessible and ultimately safer for a wider range of practitioners. And for experienced surgeons, it offers tremendous efficiency and reduces fatigue during long, complex cases, ensuring more uniform and reliable closures, especially when placing many stitches.
That's fascinating. So, does this mean less intensive training time for surgeons to become proficient in these intricate skills? Or does it primarily lead to more consistent results even for highly experienced surgeons? And what are the broader implications for patient safety when the human factor of a complex, highly variable manual skill is standardized by such a device? This seems like a massive leap forward in democratizing advanced laparoscopic techniques.
It's a bit of both, actually, and the impact is profound. For residents and newer laparoscopic surgeons, it certainly helps reduce that initial steep learning curve. There's no doubt about that. It allows them to perform complex suturing with a higher degree of consistency earlier in their training. This accelerates their readiness for more challenging cases.
Okay, so faster proficiency.
Yes, and for experienced surgeons, it primarily offers efficiency and reduces physical and mental fatigue, particularly during lengthy multi-hour procedures where dozens of stitches might be required. Imagine the hand strain over several hours. These devices alleviate that significantly.
Makes sense. Less fatigue means fewer potential errors, too.
Absolutely. The broader implication for patient safety is substantial. By standardizing the stitch placement, the needle trajectory, and the tension, these devices minimize variability in surgical technique. This standardization can lead to reduced complications like tissue tearing, uneven healing, or compromised anastomosis, which are those critical connections between organs. It's about building reliability and predictability piece by piece into the surgical process, improving overall patient outcomes and making advanced reconstruction more reproducible.
Reliability and predictability, keywords in surgery.
Definitely. Next up, we have knot pushers. Now, while needle holders allow for both intracorporeal and extracorporeal knot tying, knot pushers are specifically designed for the latter technique. When surgeons choose to tie an extracorporeal knot, meaning the knot is formed outside the patient's body, which is often faster or easier for particularly complex knot configurations, a knot pusher is then used. Its job is to safely and precisely advance that pre-tied knot down the suture and into the peritoneal cavity, securing it against the tissue.
So if you're tying the knot outside the body, which sounds like it would be much easier and more tactile than tying it inside, why do you need a special tool just to push it in? Couldn't a surgeon just use another instrument or even, I don't know, somehow guide it through the port? It seems like an extra step.
That's an excellent question, and it highlights the need for specialized design even in what seems like a simple action. Even though the knot is tied externally, the process of advancing it into the body requires precise, controlled movement.
Okay.
You can't just shove it in. The port through which the suture passes is relatively small, and the internal environment is delicate. A knot pusher ensures that the knot seats correctly and securely against the tissue. It does this without snagging on the trocar port itself, without twisting the suture, and crucially, without causing any incidental damage to the surrounding delicate internal structures as it's being pushed down.
So it prevents snagging and ensures it lands right where it needs to.
Exactly. The long, slender design of the knot pusher allows for this controlled, linear advancement, guiding the knot perfectly and firmly into place. This ensures maximum security and appropriate tension without causing tissue ischemia. They are truly indispensable for surgeons who prefer extracorporeal techniques due to their advantages in certain situations. Like when speed is critical or when very complex, multi-throw knots need to be tied and perfectly secured with direct visual confirmation of knot integrity before being seated internally. It ensures the integrity of the repair from start to finish.
It's amazing how much engineering goes into tying the perfect knot, whether inside or outside the body, compensating for all those inherent laparoscopic challenges. But what if the next leap in innovation wasn't about making knot tying easier, but about making it, well, unnecessary? That sounds almost revolutionary in terms of saving time, reducing complexity, and potentially even improving uniformity of closure.
You've anticipated the next step perfectly. That brings us to one of the most exciting and truly game-changing innovations in suturing: barbed sutures. These are truly ingenious sutures that feature tiny, microscopic barbs along their length. These barbs are barely visible to the naked eye but make a profound functional difference, completely altering the mechanics of tissue approximation. They were a topic of intense discussion and excitement when first introduced at surgical conferences, promising to streamline complex closures. Everyone was talking about them.
Okay, no knots. That genuinely sounds almost too good to be true for something as critical as holding tissue together inside the body. How do these tiny barbs actually work? And how can they possibly replace the inherent security of a traditional surgical knot, which has been the gold standard for centuries?
It really is a fundamental shift in technique, I agree. The mechanism is quite clever and based on a unidirectional principle. These tiny barbs are precisely engineered to anchor themselves into the tissue as the suture is passed and tension is applied. Think of them like little fishhooks, but microscopic. They create a one-way mechanism. Once the suture is pulled through the tissue and tensioned, the barbs resist back migration, effectively holding the tissue edges together without the need for a surgeon to tie a physical knot.
Like a tiny internal zip tie almost.
That's a great analogy. Yes, like a series of tiny self-locking anchors along the suture line. This design not only eliminates the time-consuming and technically demanding step of not tying in laparoscopic surgery, a significant time saver truly, but also helps to maintain tension evenly across the entire length of the suture line.
The even tension part sounds crucial.
It's incredibly vital for optimal tissue approximation and healing. It reduces the risk of gaps or areas of excessive tension that could cause ischemia that reduce blood flow we talked about and compromise the repair. There are different types too. Unidirectional barbs for single-pass closure, or bidirectional barbs that allow tissue to be pulled from two directions toward the center, creating even greater stability.
Interesting. Where are these most useful?
They are particularly useful in specific procedures, such as myomectomy, which is the removal of uterine fibroids from the uterus, where securing multiple layers of tissue is critical, or in various forms of gastrointestinal suturing, where continuous, secure closure is paramount. They also come in various materials, both absorbable, they break down over time as the body heals, and non-absorbable for permanent support.
So what are the main takeaways? Why choose barbed?
The critical benefits are tremendous time efficiency, as eliminating knot tying can save significant surgical time, which translates directly to shorter anesthesia exposure and reduced operative risk for the patient. Second, and equally important, they ensure consistent, even tension along the entire suture line, which is absolutely vital for robust healing and minimizing the risk of complications such as dehiscence.
Dehiscence. That's when the wound comes apart.
Exactly. When the surgical wound edges separate or pull apart prematurely, a feared complication. Barbed sutures help prevent that by distributing the load evenly.
That's brilliant. Imagine a tiny unidirectional zipper that keeps tissues perfectly aligned and secure without a single knot to unravel or come loose. This isn't just an incremental improvement. It feels like a fundamental shift in how surgeons approach closure, especially when they're working through tiny access points. It's a game changer in terms of both efficiency and precision, freeing up mental bandwidth for the surgeon to focus on tissue handling rather than knot mechanics. Okay, we've seen the incredible evolution of surgical sewing with these specialized sutures and holders designed to manage the unique constraints of laparoscopy. But beyond traditional suturing, what other ingenious methods do surgeons employ to put things back together or even divide them with precision in a minimally invasive setting? Here's where it gets really interesting, perhaps even more so for those of us who appreciate clever mechanical solutions. Let's talk about surgical staplers.
You're absolutely right. While suturing remains vital, surgical staplers truly revolutionized minimally invasive surgery, perhaps even more profoundly than any other single innovation in terms of procedural enablement. They were a massive leap. They represent a quantum leap in the speed and uniformity with which surgeons can approximate and divide tissues. If we connect this to the bigger picture of surgical innovation, staplers provided a solution that dramatically shortened operative times for complex resections and reconstructions. This made procedures safer and, crucially, allowed many operations that were previously only possible through large open incisions to be performed laparoscopically.
So they enabled more minimally invasive surgery overall.
Absolutely. They brought an unprecedented level of mechanical consistency to a process that was previously highly dependent on individual manual dexterity and endurance. Let's start with linear staplers. These devices are in essence surgical workhorses designed for both division and closure simultaneously.
Both at once.
Yes. Their primary function is to place multiple precisely aligned rows of surgical staples while simultaneously cutting cleanly between those rows. Imagine a single instrument that can create a secure hemostatic, that means blood-stopping seal on both sides of a cut, all in one synchronized, incredibly rapid action.
Wow.
The staples themselves are often shaped like a bee when fired, which helps to distribute tension evenly and promote blood flow to the tissue edges for healing.
Simultaneously cutting and stapling, that sounds incredibly efficient, almost like a high-tech internal guillotine, but it also implies an extreme level of precision is needed to avoid errors, right?
Absolutely. Precision is key. Their applications are incredibly widespread and critical in complex abdominal, thoracic, and even some gynecological surgeries. For instance, they are indispensable in bowel resections, where a diseased section of the intestine needs to be removed and the remaining ends either closed off or prepared for reconnection.
Okay, bowel surgery makes sense. Anywhere else?
Oh, yes. They are also crucial in procedures like sleeve gastrectomy, a type of weight loss surgery where a large tubular portion of the stomach is created by removing the outer curve. And in lung resections, where portions of lung tissue or even entire lobes need to be carefully divided and sealed to prevent air leaks or bleeding.
Lung surgery too. Okay, so what are the main advantages?
The benefits are profound. They create a clean, secure division and closure in one rapid action. This is absolutely vital for maintaining sterility, minimizing the risk of contamination, and most importantly, preventing leaks in organs like the bowel or lung, which could lead to severe life-threatening complications like peritonitis.
Peritonitis, that's a serious infection in the abdomen.
Yes, a dangerous inflammation of the lining of the abdomen, or even sepsis, which is the body's overwhelming and life-threatening response to infection. The uniformity of the staple lines, often available in different heights and materials, titanium being common, ensures appropriate tissue compression and reduces the chances of tissue damage or uneven healing. That's a major factor in patient recovery.
Uniformity and speed seem to be the big wins here.
They are huge. Moving on, we have circular staplers. Unlike linear staplers that create a straight line of staples in a cut, these devices are specifically designed to create a perfectly circular connection. They are predominantly used to form secure end-to-end or side-to-end anastomoses, those critical connections between tubular structures.
An anastomosis sounds like a very important connection indeed. It implies bringing two vital parts together seamlessly. What kind of procedures really need this perfectly circular, secure connection? And what makes achieving it so critical in a minimally invasive setting?
You're absolutely right. An anastomosis is one of the most critical surgical connections, particularly between segments of the gastrointestinal tract. Circular staplers find their primary and most impactful use in colorectal surgery.
Ah, colon and rectal surgery.
Exactly. For rejoining sections of the colon or rectum after a diseased portion, perhaps due to cancer, diverticular disease, or inflammatory bowel disease, has been removed. In these procedures, achieving a perfect, leak-proof circular seal is paramount. A compromised seal, or anastomotic leak, is one of the most feared and potentially devastating complications in colorectal surgery.
Why is a leak so bad there?
Because bowel contents can spill into the abdominal cavity, leading to severe infection, sepsis, multiple reoperations, and unfortunately sometimes even death. The circular stapler, often inserted through the anus or a separate port, precisely aligns the two ends of the bowel, compresses the tissue, and then simultaneously fires a double row of circular staples while cutting out the redundant tissue inside the circle.
So it staples and trims at the same time.
Correct. This ensures a precise, consistent, and strong circular connection, significantly reducing the risk of such leaks and promoting optimal healing. It's a testament to mechanical precision, replacing the extreme difficulty of hand sewing a perfect circular connection deep within the pelvis. These devices have been instrumental in allowing procedures like low anterior resections for removing rectal cancer to be done laparoscopically, minimizing the need for permanent colostomies in many patients.
That's a huge quality of life improvement.
Immense. So if we connect this to the bigger picture, the overall benefits of staplers, both linear and circular, are substantial. They provide remarkably uniform closure, significant speed in performing complex resections and reconstructions, and when used correctly with appropriate tissue selection, demonstrably reduce leak rates compared to hand-sewn techniques in many situations.
So better, faster, safer in many cases.
Exactly. This combination dramatically improves patient outcomes, shortens surgical times, and facilitates the adoption of minimally invasive approaches for increasingly complex cases. They transformed many lengthy open procedures into faster, less traumatic laparoscopic ones, making surgery safer and recovery quicker for patients.
These really are incredible devices, fundamentally altering what surgeons can do inside the body. And finally, in this category of putting things back together, we have mesh fixation tacks. I've certainly heard of surgical mesh being used, especially in hernia repairs, but I'm curious about the specific tools that anchor it. How do they stick it in place?
Indeed. In hernia surgery, where a weakness in the abdominal wall has allowed an organ or tissue to protrude, synthetic or biological meshes are routinely used to reinforce the weakened area. These meshes need to be securely attached to the surrounding healthy abdominal wall to provide lasting structural support, bear the brunt of abdominal pressure, and prevent the recurrence of the hernia.
So the mesh needs solid anchoring.
Absolutely. That's where mesh fixation tacks come in. They are specialized devices designed specifically to fix the mesh, typically using either helical-like spiral tacks or other absorbable fixation devices.
Helical tacks. These sound like miniature construction tools being used inside the body. What makes these particular devices so effective for securely fixing a mesh, which is essentially a supportive patch, to the abdominal wall? Is it their shape, their material, or how they're deployed, particularly in a laparoscopic environment?
It's truly a combination of all those factors, optimized for a unique challenge. These tacks are precisely designed to act like miniature staples or screws, but specifically for mesh. They quickly and reliably secure the mesh to the surrounding healthy tissue of the abdominal wall, which might be muscle, fascia, or peritoneum.
Like tiny screws almost.
Very much so. The helical design of some tacks allows them to penetrate and hold tissue with a twisting motion, creating a very strong mechanical anchor, much like a tiny corkscrew. Other designs use a simpler, barb-like attachment.
And you mentioned absorbable.
Yes, what's particularly clever about many of these devices is their absorbable nature. This means that while they provide immediate, critical structural support for the mesh, as the body begins its healing and tissue integration process, they gradually dissolve over time.
So they disappear eventually.
Correct. This leaves no permanent foreign material behind once the body's own tissues have grown into and reinforced the mesh, which can be an advantage in certain clinical situations. It might reduce the long-term presence of synthetic materials and potential for chronic pain or foreign body sensation. Non-absorbable versions also exist, of course, chosen based on the type of mesh, patient factors, and surgeon preference.
Okay, so there are options.
Always options.
Okay.
These tacks allow for rapid, secure, and evenly distributed fixation of the mesh, crucial for preventing mesh migration and ensuring a robust, long-lasting hernia repair, all through those tiny laparoscopic ports.
So you're not just closing an incision or reconnecting an organ, you're actually reinforcing, building new strength where it's needed most, almost like internal structural engineering, all with incredibly tiny, precise anchors. It's a remarkable fusion of surgical repair and internal construction, all happening with minimally invasive techniques that reduce patient recovery time significantly. With all this incredible technology and precision engineering at play, performing such delicate and vital reconstructions inside the human body, safety must be absolutely paramount. It can't just be about efficiency and clever design. It has to be about guaranteeing the best possible outcome for every patient. What are the absolute non-negotiables, the critical safety measures that surgeons must follow when they're using these advanced tools for tissue reconstruction? The margin for error must be incredibly small.
You're absolutely right. Knowledge is most valuable when understood and applied, and nowhere is this more critical than in surgery, where it directly translates to patient safety and well-being. You've hit on the most important point. Technique and vigilance are just as crucial as the technology itself. This raises an important question that is constantly debated and refined at medical conferences.
How do you use these powerful tools safely?
Exactly. What specific precautions ensure that these powerful, efficient tools are used without complication, safeguarding the patient's recovery above all else? There are several essential safety protocols that surgeons meticulously follow. First, and perhaps one of the most vital, is anastomosis testing. After creating a new connection, particularly in the gastrointestinal tract using staplers or sutures, the surgeon will always test that anastomosis for leaks.
Always.
How do they test it?
It's often done by injecting air or saline into the lumen of the organ distal to the connection and observing for any bubbles or fluid egress, any leakage through the newly created seal. The why behind this is profoundly important. A leak in an anastomosis can lead to severe infection, peritonitis, that dangerous inflammation we mentioned, and even sepsis.
Life-threatening stuff.
Absolutely. These complications can drastically worsen a patient's prognosis, leading to prolonged hospital stays, reoperations, and even death. Proactive testing allows for immediate repair if a leak is detected, before it becomes a major life-threatening problem.
Check your work, basically. Makes sense. What else?
Second, specifically with staplers, it is absolutely crucial to ensure they are aligned correctly and the tissue is adequately compressed before firing. These devices are incredibly powerful, and a misfire or improper placement can be catastrophic.
Catastrophic how?
Well, if a stapler isn't perfectly positioned, if the tissue isn't properly captured within its jaws, or if the tissue thickness is mismatched for the staple height, it can lead to an incomplete tissue closure, a compromised staple line, or even severe damage to adjacent structures. This can result in bleeding, leakage, or organ injury, necessitating immediate and often complex corrective surgery. Surgeons are trained to check visual cues, palpate where possible, and even use things like fluoroscopy in some cases to confirm alignment. Every detail matters when dealing with such powerful, irreversible tools.
Okay, alignment is critical. Got it. What about sutures?
Third, concerning suturing, surgeons must always avoid excessive tension on sutures. While the goal is to bring tissue edges together securely for healing, pulling too tightly can have detrimental effects at a cellular level.
Too tight is bad.
Very bad. Excessive tension can cause what we call ischemia, which is the reduction or cessation of blood flow to the sutured tissue edges. Tissues that are deprived of adequate blood supply cannot heal properly and are at a much higher risk of delayed breakdown, or necrosis, meaning the tissue dies due to the lack of blood supply. This, in turn, can lead to complications like dehiscence or wound separation or a leak in an internal repair. It's a fine balance between achieving mechanical security and maintaining tissue viability, requiring years of surgical judgment and feel.
Experience really counts there.
It does. Finally, when using barbed sutures, careful handling is paramount, especially during placement. Remember how they work.
The one-way barbs.
Yeah, exactly. Once a barbed suture is placed and tensioned, it cannot be easily withdrawn or repositioned without cutting it. This highlights their unique, one-way design and the irreversible nature of the initial placement. Surgeons must be absolutely confident in their placement and trajectory on the first attempt because there's no easy undo button.
So measure twice, cut once,
Right.
or rather place once.
Precisely. Repositioning a barbed suture often means removing it entirely and starting over, which can waste valuable surgical time, increase cost, and potentially cause additional tissue trauma. This characteristic demands even greater precision, forethought, and confidence during the suturing process. All these safety points are continuously emphasized in surgical training programs and during recertification, reflecting their critical importance.
So what does this all mean for the patient? These aren't just dry technical steps or optional guidelines. They're literally life-saving protocols. They represent the rigorous standards, the years of training, and the constant vigilance required to ensure that the incredible benefits of these advanced instruments translate directly into positive, safe outcomes for every individual undergoing surgery. It's truly about meticulous application of technology.
Precisely. These precautions are directly linked to preventing complications, ensuring successful healing, and ultimately securing the patient's swift and complete recovery. They underscore the critical thinking, meticulous planning, and unwavering attention to detail that is required at every single step of a surgical procedure, especially when dealing with such powerful and precise instrumentation. It's about leveraging technology responsibly, understanding its capabilities and its limitations, and always prioritizing the patient's well-being.
Today, we've taken a deep dive into the fascinating world of surgical reconstruction and laparoscopy. We peeled back the layers to explore the indispensable tools that make these procedures possible, starting with the specialized instruments for fine stitching. We looked at needle holders, the extended tungsten carbide tipped fingers of the surgeon, and the ingenious endo-stitch devices that automate complex movements, standardize stitch placement, and significantly reduce the learning curve for these intricate skills. We also covered knot pushers, essential for securing those extracorporeal knots safely, and the revolutionary barbed sutures, which completely eliminate the need for knots, saving precious surgical time and ensuring even tension across the repair. Quite the lineup for sewing.
Definitely. And then we moved beyond thread, examining the powerful surgical staplers, both linear, which simultaneously cut and seal for large resections in organs like the bowel and lung, and circular, which create those critical leak-proof circular connections in procedures like colorectal surgery. We also highlighted mesh fixation tacks, acting like miniature, often absorbable construction tools to reinforce weakened tissues in hernia repairs. We connect this to the bigger picture. All these specialized instruments together enable safe and incredibly effective tissue reconstruction, transforming what were once highly invasive, lengthy procedures into minimally invasive marvels. It's a testament to human ingenuity in solving complex problems under the most extreme, life-critical conditions, driven by a relentless pursuit of better patient outcomes.
So what does this all mean for you, our listener? Consider how these seemingly small, intricate innovations in surgical instruments, like a tiny barb on a suture or a perfectly aligned B-shaped staple, are cumulatively pushing the boundaries of what's possible in medicine. They're leading to faster recovery, significantly less postoperative pain, and dramatically better long-term outcomes for millions of people worldwide. It's a constant evolution, a testament to how specialized tools, rigorous training, and unwavering safety protocols can transform human health. How might such a relentless pursuit of precision and efficiency influence other fields beyond medicine, or even inspire future developments in areas we can't yet imagine, fundamentally changing how we approach complex challenges? Something to think about.
Indeed. In our next deep dive, we'll continue our exploration of laparoscopic tools by examining suction and irrigation instruments, the essential cleaning crew of laparoscopy, ensuring a clear and safe surgical field throughout the procedure by managing fluids and debris. Stay tuned for more insights from the cutting edge of minimally invasive surgery.